feeling hollow, my bones like brittle glass. Life's heavy burdens follow, but I won't let them pass. The weak can find their fire in every aching step, climbing a little higher in the void where dreams are kept. I'm not a shadow anymore, I'm finding muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow. My hands are shaking steady, sweat drips like melting ice. I've never felt so heavy, but I don't need to think twice. Fear feeds on fragile whispers, but I'll scream till it's worn out. Every scar turns it into blisters, I keep fighting, shed the doubt. I'm not a shadow anymore, I'm fighting muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow.
Okay, so have you ever heard of deconditioning syndrome?
Deconditioning syndrome.
Yeah, deconditioning syndrome. Sounds kind of like, I don't know, something out of a sci-fi movie, right?
Yeah, a little bit.
But we're actually diving into some excerpts from a medical text today to kind of unpack this whole concept.
Interesting.
Because it's not just about, like, defining it.
Right.
It's about understanding why this matters.
Okay, yeah.
Especially if you or someone you know has ever experienced prolonged inactivity.
Mm-hmm.
You know, maybe bed rest after surgery or an illness or something.
Yeah, for sure.
So to kick things off, the history behind this is actually kind of surprising.
Yeah.
Deconditioning was first observed in World War II soldiers.
Oh, wow.
Yeah, soldiers who were bedridden after injuries.
Okay.
And so doctors started to notice this weird thing. You know, these soldiers, they weren't just getting weak, you know, like you might expect.
Right.
Their entire bodies seemed to be kind of like declining.
Huh. That's interesting. So, like, what's the clinical definition of this then?
Well, I mean, deconditioning syndrome is essentially a decline in physical and functional ability. That happens because of inactivity, immobility, or bed rest.
So, it's like, you know, if you think about a car that's been left idle for too long,
Oh, okay.
battery drains, things start to rust.
Yeah.
And eventually it just won't run the way it used to.
Right, right. Okay, that's a good analogy. So we're talking about more than just losing some muscle, you know, after a few weeks of being on the couch.
Oh, yeah, for sure.
Like, what kind of decline are we talking about here?
I mean, think about just everyday tasks, like getting dressed,
Right.
making a meal,
Yeah.
or even just walking to the mailbox.
Right.
Those things can become incredibly difficult for someone who's dealing with deconditioning syndrome. You know, you might notice significant muscle weakness,
Okay.
problems with balance,
Yeah.
coordination.
Right.
You might even see changes in your breathing. Really?
And heart rate.
Wow. Okay.
True.
I'm starting to see, like, this is a lot more serious than I originally thought. I guess I always assumed it was just like, you know, getting out of shape. But it's like, it affects the whole body.
Absolutely.
It's systemic.
Yeah, it's not just about, like, muscle atrophy, which is basically your muscles shrinking from lack of use.
Right.
You can also see reduced bone density, cardiovascular issues,
Okay.
and even changes in, like, your metabolism and hormonal balance.
Wow. So it's not just about feeling weak. It's like your body's ability to function on, like, a basic level.
Yeah, absolutely.
And I'm guessing this is not just something that affects hospital patients.
No, not at all.
Right.
I mean, while prolonged bed rest is definitely a major culprit,
Okay.
deconditioning can happen to anyone who experiences extended periods of inactivity. I mean, we're increasingly seeing it in our modern, like, sedentary world,
Yeah, that's true.
even among people who might consider themselves relatively healthy. Right. Okay, that's kind of alarming. What are some of the, like, less obvious things that can lead to this?
Well, there are a number of chronic illnesses,
Uh,
things like heart failure, COPD, arthritis.
Yeah?
Even some neurological disorders can contribute to deconditioning. And these conditions often make it harder for people to be physically active, so it creates a bit of a vicious cycle.
So it's like the illness itself makes you less active.
Right.
Which then leads to deconditioning.
Exact.
Which makes it harder to get back on your feet.
Yeah, absolutely.
That's tough.
And then, of course, there's aging. As we get older, we naturally lose muscle mass and strength.
Okay.
A process called sarcopenia.
Sarcopenia.
Yeah, and this makes us much more susceptible to deconditioning.
Sarcopenia. That's a
Yeah.
new one for me. What's going on in the body when that happens?
Essentially, it's the gradual decline of muscle tissue as we age. It's a complex process. It involves a number of factors, including hormonal changes,
Okay.
reduced protein synthesis, and even alterations at the cellular level.
Wow. Okay.
What's interesting is that sarcopenia can start earlier than you might think.
Really?
Some studies suggest it can begin as early as our 30s.
Oh, wow. Okay, so even if someone in their 40s or 50s is living a pretty active life, they could still be at risk.
Yeah, especially if they experience an illness or injury that requires them to be inactive for a while.
Okay.
The source material actually highlights this case study. A 75-year-old patient who was hospitalized for pneumonia.
Okay.
After just 2 weeks of bed rest, they experienced such significant muscle weakness. They could barely walk.
2 weeks.
Yeah.
That's wild. I guess it just shows how quickly this can happen.
Right.
Especially for older adults.
Exactly. And, it's not just physical factors either.
Oh, okay.
Believe it or not, psychological factors like depression and lack of motivation can play a role as well. Yeah, these things can lead to, reduced activity and exacerbate the problem.
So we're talking about like physical, medical, and
Right.
psychological factors all kind of contributing to this.
Yeah, it's a multifaceted issue.
It's not as simple as I thought.
Absolutely. It requires, a really comprehensive understanding to address it effectively.
Okay. So speaking of addressing it, what are the actual consequences of this? Like, what happens if you have deconditioning?
Well, on a clinical level, it significantly increases the risk of complications for patients.
Okay, so like what kind of complications are we talking?
I mean, we're talking things that go beyond just feeling weak.
Okay.
Deconditioned patients are more susceptible to everything,
Right.
from pressure sores and pneumonia to blood clots and falls.
Oh, wow.
Even something as simple as like a urinary tract infection
Okay.
can become much more serious in someone who's deconditioned.
Okay, so this is serious stuff.
Yeah.
And I imagine it affects recovery too. Right?
Oh, absolutely.
If you're trying to recover from an illness or surgery,
Right.
that's got to be harder.
Yeah, recovery is often delayed because the
Yeah.
body just isn't as strong or resilient as it was before.
Right, so it's not just about the immediate health risk. It's like the long-term impact on your ability to bounce back.
Exactly. And we can't overlook the impact on mental health either.
Right.
We talked about how deconditioning can lead to a loss of independence.
Yeah.
But, imagine the hate to someone's self-esteem when they can no longer do the things that they used to take for granted.
Yeah, I can see how that would be tough.
Yeah. And that sense of frustration and helplessness can really easily spiral into anxiety and depression, which just further compounds the problem.
Right. You mentioned a study earlier about ICU patients.
Yes.
What was that about?
Yeah, so the source material cited a study
Okay.
that found that ICU patients who experience deconditioning often need up to 12 months of rehab to regain their pre-illness functional levels.
12 months, that's a whole year.
Yeah.
That's a long time.
It is, and it underscores the seriousness of deconditioning and the importance of early intervention.
Wow. Okay. So we're talking about a massive impact on someone's life, physically, mentally, and even in terms of their recovery time.
Yeah.
But are there like broader implications as well? Like, does this affect, I don't know, society more broadly?
Absolutely. Deconditioning has significant societal and economic impacts.
Okay.
For starters, think about the increased healthcare costs.
Right. That makes sense.
Associated with longer hospital stays, more rehabilitation services, a greater need for in-home care.
Right. It's like a ripple effect.
Exactly. And then there's the impact on the workforce.
Right.
People struggling with deconditioning might experience reduced productivity.
Yeah.
Or even long-term disability, affecting their ability to work and contribute to the economy.
Okay. So this is a much bigger issue than I realized.
Yeah.
It's not just about the individual.
Right.
It's about their families, healthcare systems, even the workforce.
It's a complex issue with far-reaching consequences.
Wow.
But, the good news is we're not powerless against it.
Okay, good.
There are steps we can take to prevent and address deconditioning,
Okay.
which we'll dive into in the next part of our deep dive.
All right. Sounds good.
Yeah.
Looking forward to that.
Yeah. Yeah, so knowing all of that, knowing all those potential consequences,
Right.
it really highlights the need for prevention and early intervention.
Okay, yeah.
And that's where things get a bit more hopeful.
Okay, good. I'm ready for some good news. What can we do about this?
Well, staying active is definitely crucial. But it's not just about, intense workouts or anything.
Right.
Even small, consistent movements can make a huge difference in preventing deconditioning.
So, like, baby steps, literally. Like walking around the house more.
Exactly. Something as simple as taking short walks throughout the day, doing some gentle stretches,
Yeah.
or even just standing up and moving around every hour
Okay.
instead of sitting for prolonged periods.
Right.
That can have a significant impact.
That's a relief, honestly. Sometimes the thought of starting a whole exercise regimen is overwhelming,
Right.
but just, like, moving more in my daily routine
Yeah,
seems more doable.
absolutely. And, the key is to find activities you genuinely enjoy.
Right.
Because that makes you much more likely to stick with them.
Okay. Yeah.
Maybe it's gardening, dancing, swimming, taking a yoga class.
Yeah.
Anything that gets you moving and keeps you engaged.
I like that. Find the joy in movement.
Exactly.
Okay. But what about those who are already experiencing deconditioning? Like, what are their options?
So that's where a more multidisciplinary approach comes into play,
Okay.
which essentially means tackling the problem from different angles,
Okay.
utilizing the expertise of various healthcare professionals.
So like a team effort
Exactly.
with everyone bringing their own skills to the table.
Precisely. Physical therapy, for example, is often a cornerstone of deconditioning treatment.
Okay.
It focuses on rebuilding strength and endurance,
Okay.
improving mobility and flexibility,
Yeah.
and even addressing issues with balance and coordination.
So it's not just about, like, lifting weights or running on a treadmill.
Right.
It's about regaining those functional movements that we take for granted.
Exactly. And it's incredibly tailored to the individual.
Okay.
So a skilled physical therapist will assess your specific needs and limitations
Right.
and create a personalized program designed to help you reach your goals.
That makes sense. It's not one size fits all.
Right.
What about the role of nursing in all this?
Oh, nurses play a critical role in both preventing and managing deconditioning,
Okay.
particularly in hospital settings.
Okay.
They're often the first line of defense,
Good.
monitoring patients for early signs of decline and implementing strategies to promote mobility and prevent further deterioration.
So they're like eyes and ears on the ground, basically.
Exactly.
Catching those subtle changes.
Yeah, they might use things like mobility protocols,
Okay.
encourage frequent position changes,
Right.
or even just make sure patients are getting out of bed and moving around as much as possible,
Okay.
even if it's just a few steps at a time.
It's amazing how much those small things can help. What about occupational therapy? I always think of that as more like task-oriented.
Right, you're right. Occupational therapists are all about helping people regain independence in their daily lives.
Okay.
So they might teach adaptive techniques for, dressing, bathing, cooking,
Okay.
or recommend tools and assistive devices
Yeah.
to make those tasks easier and less strenuous.
So that's about empowering people to do what they need to do, what they want to do.
Right.
Even if they have those limitations.
Exactly. It's about finding ways to adapt and modify activities to maintain a sense of autonomy and quality of life.
Okay.
And of course, we can't forget about nutrition.
Right. Of course.
A registered dietitian can play a key role
Okay.
by ensuring patients are getting the nutrients they need
Right.
to support muscle recovery and overall healing.
Yeah, that makes sense. So it seems like this collaborative care model,
Right.
bringing together all these different specialists, PT, nursing, OT, dietitians,
Yeah,
that's really the key here.
absolutely. You hit the nail on the head. It's about recognizing that deconditioning is a complex issue.
Right.
It requires a multifaceted approach.
Okay.
And the source material highlights a great example of this.
Okay.
A post-surgical patient who benefits from a combination of physical therapy for mobility,
Okay.
nutritional counseling to optimize their diet,
Right.
and nursing care to ensure they're adhering to their recovery plan.
Yeah. It's interesting to see how all those pieces fit together
Right.
to create that individualized plan.
Exactly.
But I'm also wondering, like, what can individuals do on their own, even outside of, like, a formal healthcare setting.
Absolutely. In fact, that's one of the most empowering aspects of this whole discussion.
Okay, let's hear it. What can people do to take charge of their own health in this regard?
Well, we've touched on the importance of staying active, even in small ways,
Right.
but it's also crucial to address any underlying health conditions
Okay.
that might be contributing to deconditioning.
Right.
So if you have a chronic illness, work closely with your doctor
Yeah.
to manage it effectively, which can often make it easier to stay active.
Right. So it's about taking a holistic approach.
Exactly.
Like managing your overall well-being can have a direct impact.
Yeah. And don't underestimate the power of social support.
Oh, okay.
Having friends or family members to exercise with,
Right.
or who just encourage you to stay active,
Yeah,
can make a huge difference.
I know. Like for me personally,
Yeah.
that buddy system always helps to
Yeah.
stay on track.
It makes a big difference. And finally, don't hesitate to seek professional guidance.
Okay.
If you're concerned about deconditioning, whether for yourself or a loved one,
Right.
talk to your doctor or a physical therapist.
Okay.
They can assess your needs, identify any potential risk factors,
Yeah.
and help you create a safe and effective plan.
That's great advice.
Yeah.
Sometimes it's hard to know where to even start.
Right.
So having that expert guidance can be huge.
It really can. Remember, taking proactive steps to stay active, manage any underlying conditions,
Right.
and seek professional support when needed
Okay.
is essential for preventing and addressing deconditioning.
Right.
It's about empowering yourself to take control of your health and well-being.
I love that. Okay, so much good information here. Let's recap everything we've learned in the next part of our deep dive. This has been really eye-opening.
Yeah.
Deconditioning, it's a much bigger issue than I thought,
It is.
affecting everything, you know?
Yeah.
Individual health and well-being to like societal trends, economic trends, everything.
It really is a complex issue with far-reaching consequences.
Yeah.
But I think the important thing to remember is that we're not powerless against it.
Right.
There are so many things we can do, both individually and collectively, to prevent this and address it.
I totally agree. And I like how this conversation has shifted from like
Yeah.
alarm to empowerment.
Right.
It's not about being afraid of deconditioning. It's about understanding it
Absolutely.
and then taking those proactive steps
Right.
to protect ourselves and our loved ones.
Exactly. Knowledge is power.
Yeah.
The more we understand about it, the better equipped we are
Right.
to make informed decisions about our health and our lifestyles.
So to wrap things up for our listeners,
Mhm.
what's like the one key takeaway you want them to have from today?
I think the most important message is that movement is medicine.
Hmm.
Even small, consistent movements can have a profound impact on our physical and mental well-being, especially as we age.
Right.
So find activities you enjoy, make movement a natural part of your daily routine,
Yeah.
and don't be afraid to seek professional guidance if you need it.
That's a powerful message.
Yeah,
It's a reminder that we have more control over our health than we realize.
absolutely.
And sometimes it's the small things, the consistent actions that make the biggest difference long term.
Exactly. It's about cultivating a lifestyle that prioritizes movement,
I love that.
both for ourselves and for future generations.
This has been a great deep dive
Yeah.
into deconditioning syndrome. We've covered a lot of ground today, from the historical origins to the modern day implications, and most importantly, those empowering steps we can take
Right.
to prevent it and address it.
Absolutely.
It's been a pleasure chatting with you.
It's been great being here.
And for our listeners, if you're interested in learning more
Hmm.
about how in-home physical therapy services can help with this, be sure to reach out. We have tons of resources
Right.
to help you stay informed and take those proactive steps
Yeah.
toward a healthier, more active life.
Absolutely.
Thanks for joining us on this deep dive, and we'll see you next time.
See you later.